Okay. My name is Marcus. I'm an outreach worker for Concerted Care Group. So I am responsible for educating the community about the services and the goals of CCG. Services that include a comprehensive approach to substance abuse treatment and mental health services, as well as goals that include the treatment of a person's whole life and not just their addiction. Here in Baltimore, a city that was once referred to as the United States heroin capital, we unfortunately deal with a lot of drug abuse, a lot of poverty, a lot of violence, a lot of homelessness, and multiple other issues. Therefore, on a day-to-day basis, I encounter individuals who are on the verge of despair and despondence. Many of our clients and many of the people in this community suffer from mental illnesses. And as we know, suicide is highly associated with substance abuse issues, psychological disorders, and mood disorders. In addition, drug abuse can often bring about symptoms of mental illness, and mental illness can lead to drug abuse by way of an individual self-medicating. So basically, I indirectly and directly are involved with suicide prevention by linking potential clients up to comprehensive substance abuse treatment and mental health services. In my experience, one of the biggest roadblocks to improving suicide prevention would be, since I'm an outreach worker, I deal with individuals on a day-to-day basis, face-to-face, person-to-person. So my perspective is a little different. I feel like a roadblock is raising awareness that these services exist and making clients feel like these services are needed in their lives. When you're going through withdrawal, you're poor, you're unsafe in your own community, sometimes it's hard to see beyond those issues and realize that you need treatment, or you need to be connected to these services. I myself know this from experience because when I was young, I had suicidal. And I felt like my life wasn't worth living at one point in time. And at the same time, I didn't want any treatment. I didn't know I needed treatment. I didn't have any access to services in my community. So I was kind of in my own bubble. So with that said, I think just the realization that these services is needed, and sometimes the inability to resolve the multiple issues surrounding an individual that may make him or her feel like their life isn't worth living are huge roadblocks to suicide prevention. I hope that more people become aware of these services. I hope that more people join Concerted Care Group Behavioral Health Program or any other effective behavioral health program for that matter. I hope that they complete the program. I hope that they themselves go on to become advocates for these programs. Sort of like an each one teach one model, because in my opinion, someone who has been directly impacted by a mental health illness or a substance abuse issue or had suicidal thoughts in the past are in a better position to reach more people that may be suffering from those same illnesses. Also, from my studies and my experience, many people who have died by way of suicide had already reached out to healthcare providers. So I feel like care providers should make suicide prevention a core priority by providing better awareness and treatment for people who are at risk of suicide. Also, a cross-training between the two different institutions, I feel like would help with the identification and the treatment process. I also feel like a greater access to mental health services would be greatly impactful. Because in certain at-risk populations, it's not a lot of those treatment facilities. So I feel like that would make the healthcare providers and mental health services greater partners in suicide prevention, and increase investment in the resources of the quality, the expansion, and the advertisement of these mental health services is needed, as well as ideally a collaborative effort to partner mental health services, healthcare providers, and community-based self-help groups together to provide a more long-term, comprehensive treatment for individuals who are at risk of suicide. I feel like that would be greatly impactful as well. I believe I'm sorry, I don't want to go into the last question. The last.
You can go ahead. You still have a couple of minutes.
Okay. I believe the smallest effort would be a strength-based approach that would enhance a client's self-efficacy. I believe that a client should believe that they have the ability and the power to organize and execute plans that would result in positive results in their lives. I feel like that's the smallest thing we can do as individuals, especially as a outreach worker. I try to build on the assets of the people and the clients that I encounter and engage with every day versus focusing on the problems or the issues. So for me, that's the smallest thing. The biggest thing is one of my favorite concepts. It's a civic engagement concept called public sociology. Now, essentially, public sociology it connects academic universities with the everyday citizens in the community this is designed to empower the members of the community, but to become co-creators and co-agents of change. So ideally, an alteration of this concept would connect healthcare providers, mental health services, everyday citizens in the community, and the directly impacted will all sit around at the table and co-create solutions that would improve suicide prevention. Now, for me, it's designed to do two things. The first thing is to create unity amongst healthcare providers, mental health services, everyday people in the community, as well as the directly impacted. And the second thing it does is it empowers the everyday citizens in the community and the directly impacted to be more proactive in their own treatment process.
Great. Thank you so much. And you're a wonderful example of why this co-creation is so critically important. So thanks for your perspective.